The United States, the United Kingdom, Canada, Saudi Arabia, Australia, United Arab Emirates, among others, are the preferred destinations of Nigerian doctors.
Absolutely, but sadly, Nigeria has more than 70,000 doctors registered with the Medical and Dental Council of Nigeria, but only about 40,000 of this figure are currently practicing in the country. And more than 70% of those still practicing are thinking of seeking jobs in other countries.
Well, at least 4,756 Nigerian doctors are practicing in the UK alone. A survey by the NOI polls showed that 8 out of every 10, and that's representing 80% medical doctors in Nigeria, seek work opportunities abroad. Well, this mass exodus is really bleeding the nation's already fragile health sector, along with other challenges. Now, what can be done about this brain drain, and is the government even seeing this as a big challenge? Well, we'll be asking our guests that question. We still have Ife Onyegbule, of course, with us in the studio, and joining us to talk about this as well is the publisher of Cross River Watch, Agba Jalingo. Good morning to you, and thank you for joining us on the show.
That was a pleasure. Good morning.
Yes. Are you alarmed at the rate Nigerian doctors are leaving the country, or you're just complacent that maybe, of course, new ones are being trained on a daily basis?
Well, there are very few things that still alarm me about this country, very frankly. Very few things, because we have seen everything. So I'm not alarmed, but I'm worried. Frankly, I'm worried because the United Nations say a doctor to 600 patients. Yeah. In Nigeria, presently, from statistics, they say we have 1 doctor to 3,500.
No, to 4,000.
Okay. And I don't think that that is...
Now it's gone to roughly 5,000.
A little wonder we are dying every day. Little wonder the alternative industry is flourishing very seriously. And if you go to the road, you see the number of people drinking agbo every morning.
And killing more people.
Together and doing all of this and all of that, because you really cannot get Medicare when you get to the hospital.
So in other words, where Nigeria is more or less training medical personnel for other countries. And now there is another angle to it. There's another concern that in the UK, for example, EU doctors are leaving because of Brexit, which means there's a huge demand for doctors from the Commonwealth countries.
Now that you just talked about the UK, I have this here. It says that as of July 2017, over 4,765 Nigerian doctors are working in the UK. You can imagine that. So, well, you ask the question, why would anyone want to stay in a place where insecurity is the order of the day? We've just gone through the papers, and every paper that you flipped through, 9 killed, 20 injured, and all of that, herdsmen this, herdsmen that, soldiers killing. Who would want to stay in such a place?
But when you ask the doctors, especially those living
a conducive environment,
conducive environment for
their
welfare,
working conditions.
But even in a place like Lagos, where there's no terrorism, the doctors are living. Yes. In fact, in the past 2 years, the records are saying that about 800 doctors resigned from hospitals that are owned by Lagos State. And in fact, some sources are even saying that last year alone, 100 doctors resigned from the University College Hospital in Ibadan alone. There's no terrorism in those locations. But I just think that when you go to, their working conditions are horrible. When I say horrible, I know we did a recent investigation, Cross River Watch, about UCTH in Calabar. How that place has become a mortuary. Yes, we accept that the CMD, I must say, he's standing trial, so we can say that he's also emerged in the corruption. He's in court. But corruption has destroyed these facilities. You spend money to train yourself, there are no places to work. I think it's only in Nigeria that you see doctors that are looking for jobs.
Do we understand the enormity of what has happened to Nigeria's health sector, including every other sector that you can even imagine?
We do.
I have an idea.
The same countries that Nigerian doctors are running to now used to come to places like the UCH, Saudi Arabia, for example, even from the UK.
They were conducting interviews.
Aisha Sise had to bring her mother to Nigeria for quick treatment there. Nigeria, it's been established. It's been established, really.
Only for us to now be a country where...
It's a failure of government.
He has just said it.
It's a failure
corruption,
of government.
failure of government. Let me share with you. I learned, I was told by someone who works in UPTH, that's in Port Harcourt. Yes. Someone came in for dialysis, and while you're on the dialyzer, the machine, PHCN strikes. And you know what happens?
PHCN, by the way, is the
The electric company now.
Electric company.
Privatization.
Just in case.
You know, what we have is the strike, and there you are. The man is there on the machine. He's probably not conscious. He's just sleeping there, and, you know, that thing has to
continue to
flush
work.
his blood and all that.
Yeah.
They had to turn off everything somewhere else or other places so that just that place.
Now, Ify, the sad reality of it, when you want to talk about fighting cancer in Nigeria,
Right.
in fact, you would be close
My
to
mother died
shedding
of
tears.
cancer.
No.
2 years
You know,
ago,
talking
I
to
know
many, but
what
how
I
many-
went through.
Yes. How many
I know
centers
what
do we even
myself
have
and
in
my wife
Nigeria?
went through, moving my mother from one location to
To the
another
other.
until we had to take her over. I simply know what we went through. And I'm saying that I don't know whether we have public hospitals in Nigeria. I can talk about UCTH because it's a place that I'm used to. We went there. This is a place where you see people doing surgery with candles.
Or the flashlight on their,
They
on
don't
their, on
have
their
hand
phones.
gloves. Hand gloves. Doctors don't have to work with. But we must also talk about the flip side. The flip side is that even the little that government is doing, in most cases, is being frittered away by some very, very wicked doctors.
And
I say this
CMD,
because
Chief Medical
the federal
Directors.
government provided a centralized system to pass oxygen across in UCTH. Some people sat down and decided that they need to commercialize it. They disabled the pipe, the general system, and started marketing it in cylinders.
Oh.
Because one woman who is a doctor in the hospital decided to make the husband who sells gas a contractor. And for 5 years, people are dying. I have a friend who was looking for a boy child, as it were, for 6 years. They went there, go and bring generator. He went home, brought his generator. Go and buy fuel. He went. There is no oxygen. Go and before he came, the child died.
In fact,
He came to the hospital with the cutlass and said he was going to kill
It's
somebody.
almost the same story wherever public hospital you go. When I was doing a report on health sector and pregnant women seeking cheaper alternatives, one of the hospitals, public government hospitals I went for, I asked about the process, you know, of registering a pregnant woman, and then one of the requirements is for the husband to come and donate blood. But the man told me, I can help you out. If you pay me 12,500 naira, I will find a way to help you out. Your husband doesn't even need to come and show his face. And
See,
that
the
is the
doctors
reality
collect
of what we
2,000. We have confirmed this. We have invoices. I'm saying this on air with all sense of responsibility. And every doctor in UCTH is involved. They collect, and you can't do any test. The lab is dead. The pharmacy is dead. So when you come, they refer you. There's a particular pharmacy. They call it Asiupo. We did an investigation. We have documents. That's why I can say this on air. They refer you to that place. If you don't do any tests there, when you bring the documents, they will not accept them.
So you can
And
imagine
every doctor that signs has 2,000 naira per patient, 2,000 on 20% rather on every patient.
Can we blame
And all the
these
doctors are involved.
for
All.
trying to look for other ways of surviving?
which
if
is
at least
exactly-
look, their colleagues are leaving the country.
Absolutely.
Right?
But they're looking for ways to survive in the
To augment their living.
So
They
imagine
live.
if these same doctors who are doing what they can collect that 2,000 just so
No,
that they
20%, not 2,000.
Oh,
20%. It's a
20%,
percentage. Yeah.
just so that they can stay back at home and not be part of the figure that's leaving the country and leaving Nigerians to die.
I agree.
every
Yeah, the
day.
issue is
I
come see,
agree.
come sir.
It's
That's why I say we
not-
should also talk about the flip side.
flip side,
Because like
yeah.
Osun State, for the past 1 year, they have been paying doctors 50% of their salaries, but they remove 100% tax. In Kogi State, they have been paying them 60%, and they remove 100% tax. So the conditions are favorable for this kind of corruption.
So I want to align with what you've just said. Why would you blame them? I don't blame them in any way. He's
I
just
do.
talked
I
about
blame
people
them.
who,
Because if we all choose the shortcut because things are
happens
difficult for
like
us,
let's
then we
say-
want.
let's pay them
Okay.
50% of their salary, 60%, you remove the 100% tax, and I'm asking the question, these governors or these people who do these things,
Are they
you
getting
collect your
salaries?
salaries. You're never owed salaries. Then a doctor goes to school, he
Yes.
suffers, he does everything that needs to be done, he pays his fees, he comes out, he starts the job of saving lives, and you owe him salary. Who wants to stay in a place
But then-
where his take-home cannot even take him to the bus stop?
Wow. Yes, but
Who
then
would
let's...
want that? You get home, there is no power. Your wife is looking at you, you cannot provide the needs of your family.
And you're a doctor.
And you're a doctor. Please, when that opportunity comes, they will latch onto it. It's not even only in the medical
Wait,
field.
I want to quickly ask her this question. There is another accusation, another common practice anyway among doctors.
Right.
They do private practice. And what they do is when people come to the public hospital,
They refer you to
them
the
their
place
own
where,
hospital.
exactly.
What happens to the Hippocratic Oath?
No,
You
don't
wonder.
even go there. Because you have a government hospital. He's just talked about a place where you don't have gloves. There is no spirit. You don't even have cotton wool or whatever it is that they use there. Why would they not refer them to a place where the people will go pay for? I tell you, at some point, my father needed to go to, when they were in Abuja, he needed to go to the National Hospital. When he got there, look at the long queue and everything, you know. And this doctor saw my father sitting and said to him, there's a place I will refer you to. You go there, you get the best of care. He did that. It was the man's hospital.
You know, it's amazing that we all actually have personal stories of how terrible Nigeria's health sector is. I'm going to attend a wake-up of my cousin, a 46-year-old young man who died after struggling with cancer for 2 years. He had to drive from Lagos to UCH every other week to get dialysis and what have you. At the end of the day, to put a conservative figure was put to what was spent, 27 million naira, and still he passed on. Now, that is because they even had something to what about the
people who don't have?
You just hit the nail on the head.
No cancer centers.
People who don't have.
In fact, NG, Nigeria is supposed to have about 7 cancer centers, apart from the Abuja one, and none is functioning.
I don't even blame.
We should talk about the management of the basic disease. People die of malaria.
Exactly.
People are still dying of things that tetracycline can treat.
Doctors themselves are dying of Lassa fever because...
But you know the point I also wanted to make?
Yes.
We are all on this table, to the best of my knowledge, we are all journalists. And one of the very, very chronic and endemic disease worrying our industry in Nigeria is the fact that media owners do not pay journalists. Can we, because of that?
That's another issue.
Can we, because of that, commercialize our job? Can we, because of that, throw our ethics away?
No.
And not do our job as we are supposed to do our job?
Unfortunately, there's many who have had to compromise.
But we cannot go that far.
But
we must still insist on integrity.
It's not about throwing the ethics away. I was at an event, I think last week, where they were talking about, you know, journalism and how far, you know, that it has actually been watered down.
Yes.
And Funke Gbemode was there. And she said, look, everything is now online. People read papers for free. No one is buying papers anymore.
True.
And you cannot come to say, look, something is happening, don't go to report what's happening. Some crazy things happen, you have to report it. If people need to pay for that news to be on your paper, they will. Because she said, we need to pay salaries.
Okay, let's bring figures. Let's come back to the doctors. Let's put some figures to it. What is the budget for health in Nigeria? 2018 national budget for health, less than 3%
of the national budget.
Of the national budget, that is what we have now, right? Yeah. And in the midst of that, we expect, you know, to have a fantastic response system, fantastic environment to work, well-equipped theaters.
But that's impossible.
And what have you?
No, our government is not yet ready to take care of our
That's
health.
impossible.
I don't think that's still part of their, part of their agenda. But the time they will be serious with this, we have seen state governors tell us that they are building how do they even call them? Ultra 21st century,
ultra modern.
Yeah, they have this highfalutin, and the moment they have malaria, they don't go there. Even our own president, we have heard about even the Aso Rock clinic, where even the first lady told us that they don't even have paracetamol in Aso Rock, and then they budgeted how many billion? I can't remember. I don't want to call a wrong figure on air, but I know it was billions of naira that they budgeted for even the hospital inside of Aso Rock. So, if they can do that in Aso Rock, imagine what they would do in UCTH, in UCH, in LUT.
Okay.
It is, they are not yet ready
let's put
to take care
it
of us.
in more perspective. In 2001, Nigeria signed an agreement, a recommendation made by the African Union that all signatories would at least allocate 15% of their annual budget to health.
Yes.
And since then, Nigeria has never gone beyond 5.95%, and that was in 2012.
The sincerity is not there.
So, exactly. That was
the sincerity is not there. That's
it's also a signatory to the UN Convention that says 26% for education.
That's it. You cannot tell me that you're interested in the health sector. Of course, we had a year when the president spent more time out of this country going to attend to his health. My father didn't have that kind of money. There are so many people who cannot afford it.
No, it's not like the president also had that money. It's Nigeria's money that was used to treat him anyway. I'm sure that if President Buhari was sit out of office,
how many presidents in very sane climes do you hear they step out of their countries to go get health care in other countries.
Months.
You only find that in Africa.
For months.
African leaders, they just use taxpayers' money. You travel, you get the best. I don't even want to go there, that the son of the president had issues and they had to fly him abroad. Of course, there were reports, oh, they didn't fly him abroad. He was here in Nigeria. We need to fix.
No faith in the health system and no effort to even improve it.
No, something needs to be done, I tell you.
A doctor once told me that the Nigerian politicians don't even want them to have their medical records. They don't even want the doctors here to know what's wrong with them. They are afraid that their enemies could reach out to the doctors
Political
and get
enemies.
those
It's
information.
amazing
Yeah, they're always
you have
afraid.
a Donald Trump, U.S. president, who, I mean, his doctor has been talking
No,
to
here,
the whole
once you
world.
are sick,
That's
is
it.
either
telling us about his
no,
state
because
of
those ones
health.
believe that illness is natural.
It's a natural.
The Nigerian politician
If you
believes
don't have
that
control
once you
over
are
it.
sick, is either it's your enemy that is worrying you.
That's it. Or you have one
or is it,
grandmother at
which is
home,
from your
there's one
village
woman
that are
in
running
the
after
village
you.
who's running
So you have
after
to
you.
hide it and continue
your
hiding it
political
somehow and
detractors
keep
will
hiding
use
and
it
keep
against
hiding.
you.
And
No.
as if we don't know.
Fact of the
Sincerity.
matter, Nigeria is training medical doctors and nurses
Just training
for
them.
other countries.
They are straining them.
But
They are overworking
to employ.
them.
Don't
The
let
little
us-
In
people
Nigeria,
we
the
have, they're
average doctor
overworking
earns
them.
about 190,000 per annum. That's if he does get his salary at the end of the day. In a place like the United
190,000
States,
per month.
A month, not annum.
in the U.S., $200,000.
Remember, some doctors came out, Angie.
And that is entry point.
Angie.
At entry point.
Let me just remind you, remember some doctors came out, I can't recall the country now, that they were saying that the government was paying them too much, that they were complaining. I can't remember the
In
doctor.
Canada?
In Canada, thank you,
exactly.
yeah. Like, you're just paying us too
They
much.
said the money
But
was too much.
if we look at it and spread it out, it is not just in the medical field. It's not just doctors that are leaving. When you find a very good place where the conditions are okay, where the environment is conducive, where you won't have to, worry about power, about food, about how to take care of your family, you're interested in the lives you're
See,
going
we're
to
not
save.
even
You
saying
will
pay
move.
$200,000. Nigeria, we cannot, I mean, in all fairness, we cannot compare Nigeria with the U.S.
Why can't we
But
pay
what about Rwanda? What
well?
about Rwanda, a fellow African?
No, there are a lot of our neighbors that are doing a lot
Why
better
can't
than
we
us.
pay well?
A lot of our neighbors that are doing a lot
Don't
Why
better.
go to
can't we
Rwanda.
pay well?
Everywhere.
We can't even
They're
finish
everywhere.
talking about this matter if we look at it.
But we must
People-
also make the point that there are some people die hard who are not willing to go anywhere.
Yeah, because
Yes.
We must also talk about that
Because
too.
of that-
Because there are some that are
that's-
saying that regardless of whatever is going
They
on,
will stay back
I'm not
here
going to
in
go
Nigeria.
anywhere. I'll sit back here and then follow the system until
I
we hope
met
that Nigeria will be better.
I met a
Yeah.
nephrologist in Port Harcourt. I think he's one of the 3 that you have in that region. And I was talking with the man, doctor, where and where? He says to me, look, all my life I've been here in Nigeria. I've been here in Port Harcourt. I'm saving the lives of my people here. People have been calling me, come to the UK, come to Germany, come here. The man says, look, I'm not interested in going anywhere. I will be here and do this job. But how many of that kind of doctors
It's a negligible
do we
percentage.
have?
Would you even blame
why
them?
did you
Would you
come
even
back
blame
to
such
Nigeria? And
people?
I'm
It's a
like,
negligible
because
percentage.
this is where I will add value not only to my family,
That's
but
correct.
Nigeria
to
is such a
society.
peculiar-
There
Nigeria is a
there are many
peculiar place.
Nigerians like that, but for how long can they really hold out?
For as long as we still have hope that the country will change.
They will have
For
their own
instance,
country.
I had to emigrate from, let me use that word, from Lagos to my state to go and start Cross River Watch. Because I knew that my media experience is more needed in my state. My state was not reported. The only time you hear about my state is Obudukatu Ranch, and that's all. Or when there's a disaster, or Carnival, when there's Carnival, Calabar. Outside that, we are not in the news. I say, okay, Lagos is saturated. Let me emigrate to my state and put my state in the news. There are people who are making those decisions. The owner of the biggest private hospital in Obudu, where I come from, graduated as a medical doctor. And while people were going the other way, he said, no, let me go back home. And I tell you the number of lives he is saving every day in that place.
Okay, let's talk about
There are still
these
people like that.
These doctors, Nigerian doctors outside of the shores of the country, it's not just that they are moving, but they are performing excellently well.
Excellent.
They are
Of course.
appreciated by
Excellent.
these foreign
Excellent.
countries. Remember a
Excellent.
Nigerian doctor that was, that the patient had to go on the social media to thank him on how he opened, a pregnant woman, he opened up the fetus, operated
go
on
and
it,
on
and
and
then
on and
sutured
on
her
and
back.
on and
No,
on.
but
First time
Nigerians
that
do
ever
that.
happened.
If you withdraw
First time
Nigerians from the
ever.
UK health insurance system, that system will collapse.
Canada.
Now
It is Nigerian
now that you
doctors
talk about
that are
Canada.
sustaining that
It's
system.
interesting you talk about that
And
because
Indians,
a medical expert, a doctor, of course, in Nigeria said, look, one of the solutions, the major solution is to have every Nigerian on the National Health Insurance Scheme.
Yeah.
And Can every Nigerian?
But let's talk about it. That thing works.
Can a good chunk of Nigerians?
I will encourage Nigerians to do that. I have a health insurance scheme in my house.
Okay.
It works. And for the past 1 year, I rarely get sick. By the grace of God, I don't get sick. But these days, my wife walks into the hospital and then walks out. And all we paid was, I think, 38,000 naira per annum. It works, and I will encourage. I tell my friends every day. I market the program, and like instead of you walking to the hospital,
or like it's done.
No, it's premium. You pay it all at once. Your yearly premium.
But the
and
reality,
once you pay for that year, you are covered for up to maybe they have different packages. You can cover for 250,000, 500,000 until you overshoot that amount. You will not pay 1 naira.
All right, let's just face reality.
And I think that is excellent. People can do that.
Common country analysis. The common country analysis of
For
Nigeria, the last one since 2016, is that about 80 million. Are living below poverty line. So how many people can really afford
38,000?
Let's go back to Rwanda. Rwanda has a universal health coverage in place, an insurance policy that some countries had to even go to that small country to even study how it was done. How they do it is the lower you earn as a citizen, the smaller amount you would pay to get health. And they have
we have the IAD care, for instance, in my state. State governments can do that.
NHIS in Nigeria.
That's just one. You pay 1,000 naira. They call it IAD care.
Even
in my
for
state,
public officers.
I can't say in all sincerity whether the insurance scheme has taken off. But the government has made a lot of noise about it. And all the civil servants are required to do is to pay 1,000 naira.
Civil servants. Civil servants.
Yeah, you have to be. Now they are asking private people to also join. But they are beginning with civil servants. You pay only 1,000 naira premium every month. That makes 12,000 naira in a year. But they remove 1,000 naira. But if you have a job, government is saying that even those who are outside the civil service can also enter into the scheme. They call it a IAD care. It's an insurance scheme. But like I said, in all sincerity,
that was the idea behind NHIS initially. But Nigerians never got access to it. Public servants were the ones, civil servants were the ones.
There's technology now, and I believe that some of these things can be
It's not
driven
even
and it
about
can work.
technology. When you look at it, we need the sincerity for all of these things to work. That's the truth. We need the sincerity. What has happened to the health sector is the same thing that has happened to education. No one is looking. I went to a local. Is it local? Let me call it public. I went to a public primary school.
I went to a public secondary school. I don't know how it looks like.
But at some point,
village primary school, that's where I went to. My village school, very village. I was selling Akara village school.
I grew up in Surulere. I went to primary school in Surulere. I went to secondary school in Surulere. What are we talking about? But today, go to those schools.
And speaking of education, the president is in Bauchi, and he told them that I myself would have turned out to be a herdsman if I had not gone to school.
It's true. I would have been a Panwanta in my village.
The issue of Nigerian youth being lazy and all of that and just laying about is still very much still hanging in the air. Paraphrasing, of course, he didn't say that verbatim.
Okay.
But then again, if we have a president who truly recognizes that education is at the core of any development that we want to achieve in Nigeria, what is going on? Why is the health budget what it is, 3%. Education, less than 7%.
They have plans.
There's something the government did under this administration. I don't know what is happening. The government gave, I think, $1 million each to each state, and under the claim that they want to have a primary health center in each political ward across the country.
Yeah.
And I think some states were required to pay counterpart funding to be able to access that money. I don't know how, I don't have information about how many states have accessed that. But I'm saying that the little that government is doing, it appears that even the state governments are not even interested in paying their own counterpart funding to assess this with all sense of humility and respect. I would say that the primary healthcare system in Cross River State, for instance, is one of the few things that is working very effectively. And
that is in Cross River. And talking about primary healthcare, that is really where it begins. That is where it starts from. For a nation to actually be healthy. But we're not paying...
Former late Dr. Olikoye Ransom-Kuti.
Yeah, that was the best
paid a lot of attention to that.
But of course, when one person leaves, the other person does not carry on exactly what's going on. I was going there. The primary health care, that's what we even need to focus on. That is the nearest. That is the nearest to the people, just like the local government. But you ask the question, how many people even know who their local government chairmen are? When I used to live in Ikosi, not too far from here, the man here in the local government, of course, he knows sometimes when something goes wrong, I just call. Once he sees my number, why is this madam calling? He either calls back or sends a text. come to the office. We go there, we sit and talk. He is one person, Oyesanya, he listens. Do you understand what I'm saying? He listens, he wants to know what is happening. At some point, we talked about what happens in the PHC there. He wanted to, you know, make it okay so that people can be there and access the facility. But you look at it, does this go round? We're not even talking about that. You come to me, at some point, some people were doing what you call the door-to-door campaign. If you come to me door-to-door to campaign to say, look, vote for me, what stops you from going door-to-door to look for women who are pregnant or women who have children?
And speaking of that,
and talk to them.
Speaking of that,
I don't know until the economy crumble now. They do that in
Venezuela. As he just did a report on, you know, healthcare, and especially as it affects Nigerian women. The third highest mortality rate in, you know, maternal mortality in the world is in Nigeria. Infant mortality, Nigeria.
Second.
That's it.
Second. And we're watching
That's
this
it.
go on.
A woman
And
is
while
pregnant,
we're talking about all of this, Nigerians are spending about 400 billion naira every year on medical tourism, looking for.
Yes, you go to hospitals now. You see the stand there. You see the adverts there. Do you want to have a baby in the US or the UK? Do you want to do this? Do you want to do that? And you find out. You wonder why these things cannot happen here. It is really sad. We need to be sincere.
Maybe we need a leader like El-Rufai that said every public official in Kaduna must have their children in public schools.
Yeah.
No, he's not the first. Jakonde did it.
No, yeah, okay, yeah.
Jakonde did it.
No, so I'm thinking that maybe until we have a leader that is determined, who will say that, okay, if you must serve in my government, you are going to have your children.
Well, how many leaders would want to do that?
Well, the National Assembly moved the motion on one time. We have not heard anything about it anymore, that public officers should be, you know, getting treatment.
Those National Assembly members, those ones.
Don't even talk about
it. What's wrong with those ones? What's wrong with them? But they come up with this. Is it a bad idea?
Talk about them. They travel abroad. You see them. You see them right there in the trains. They are taking pictures and putting it up. Are they not ashamed of themselves?
Okay, now countries like India, Japan have come up with this strategy to re-attract. Yeah, is there such a word? You know, back home, doctors, you know, medics abroad, and it's working. What can Nigeria do?
The citizens
to help this diaspora, medical doctors, nurses? By the way, one actress, a top Nigerian actress, actually
Regina Askia is now a nurse.
I want to mention her name. She went to the US, you know, went and studied nursing.
But you know how much she's making?
I can imagine.
Do you know how much?
An average of $80,000 per annum.
So what
how can we bring these doctors back home, especially considering the fact that they would have added some additional expertise
very quickly because of time?
The simple thing is create a conducive environment. That's just it.
Bam. You just said it. Create a conducive environment.
All right.
Okay, we'll have to leave it there. If you're Yembule, thank you so much, Agba Jalingo. It's been a stimulating discussion, and I do hope that they're listening.